There are certain things that were mentioned in the State of the Union that should have piqued your interest when it comes to healthcare. Do you know what the IRA is? And no, I'm not talking about retirement today. Sorry, guys. Today we are talking about drug prices and women's health research. I know you've heard that drugs can kill, but have you heard that drug prices can kill? Child, the way drug prices be pricing, it's a wonder anybody's getting treated. Now that you've heard the State of the Union, it's time to talk about the state of healthcare. If you missed the State of the Union or simply didn't quite understand everything that they talked about, no worries about it. We got you guys. On this episode, we'll explain everything you really need to know. Thanks for watching, and don't forget to click subscribe. So, you guys, I'm being a little cheeky, but there are real stats behind what I'm saying. Yes, in fact, drug prices can lead to some adverse outcomes. Let's talk about some recent information that came out just last year. Just last year was reported that the CDC has made note that millions of Americans are not taking their medications as prescribed, and it has only to do with the drug prices. Just in 2021, you guys, most people between the ages of 18 and 64 took at least one prescribed medication. Many of you watching this are in that group. Did you know that 8%, which amounts to 9.2 million people, actually skip doses, all because of the pricing of medications? 1.3 million people actually skipped their insulin regimen because of drug prices. Previous stats have shown that 1 in 6 diabetics actually ration their insulin. This is why these new changes mentioned in the State of the Union is really important. The fact that the amount that an individual would have to pay would be capped at $35 is a really important change and can actually save lives. We know that when you skip doses of insulin or any diabetic medication, that someone is risking their actual life. Their sugar levels can spike to dangerously high levels. The numbers are even more concerning in our uninsured population. 23% of individuals who are not covered by a health plan are more likely to skip medication doses for the same reason. Drug prices. Drugs are a significant portion of someone's cost when it comes to healthcare. It's estimated that annually, the average person pays anywhere near $167. And this number is even higher for those who are elderly. And did you hear what was said at the State of the Union? It's astronomical, the markup of insulin. The cost of insulin alone was averaging about $10, right? But what people were actually paying was up to $400 per month. $400, that is, per month. So the cap of $35 is going to make a huge difference for our diabetics. And keep in mind, there are two types of diabetes: those who cannot make insulin and those who do make insulin, but are insensitive to insulin. For people who can make insulin, a lot of those are our young people, our children. It is no secret that Americans pay more when it comes to the cost of medications than any other wealthy country in this world. Why is that? Let's dive into this topic a little bit more so that you have a better understanding of what's going on. In the State of the Union, it was mentioned that now with the new IRA, which is the Inflation Reduction Act of 2022, there are going to be several changes that are going to really make a difference in the pockets of Americans. But one thing was mentioned that should have caught your attention. Did you hear that now Medicare can negotiate drug prices similar to the VA? The VA? Okay, explain. Did you guys know that the VA has been able to, and when we say VA, we're talking about veterans. Did you know that Veterans Affairs have been able to negotiate drug prices? Say what now? What you talking about, Willis? The VA has been negotiating drug prices since 1993, you guys. You heard correctly, after the Veterans Healthcare Act was passed. And believe me, this is no shade to our vets, because I love our vets and I believe they deserve everything when it comes to their healthcare services, from mental to physical to drug prices. That's not what this conversation is about. What we're trying to say is if the VA can do it, then it is possible. That means Medicare can do it also. So some things you should know about drug pricing. So why is January and July important? Well, January and July are the times when most manufacturers, drug manufacturers, will come out with their drug pricing. Most of them will happen in January. Let's go through some historical data. Let's look at the comparison from January 2022 to January 2023. There was a variable differences amongst drugs. So you saw anything from a 99% reduction to an over 3,000% increase. 3,000. That's kind of crazy. But it happened. Let's get into it a little bit more. Over 4,000 medications saw a price increase, and 46% of those were actually higher than the consumer price index, which was 6.4%. The medication for one interesting condition that saw the highest increase in terms of dollar amount was the medication that's used to treat spinal muscular atrophy. So why is spinal muscular atrophy important? It's important because it's one of the genetic screening tests in the United States for the entire population. So you guys know that we screen for different genetic tests based on the entire population or based on the group that is more prevalent and more likely to have that condition. So, for example, we'll screen Black people for one set of conditions that are prevalent versus Ashkenazi Jews that may have other conditions, and so forth, right? So, spinal muscular dystrophy is actually a condition that is so prevalent that the recommendation is to screen all pregnant women. How prevalent is it? Well, it's as prevalent as 1 in every 10,000 births. Do the math. There's about 341 million Americans currently living in the United States. Yeah, we've increased a little bit. And so if you think of a condition that affects 1 in every 10,000 births, and I think the census would say that 341 million are alive, that's a significant portion of the population. That's why this particular condition is important. In 2022, a medication used to treat spinal muscular atrophy had one of the greatest dollar amount increases from the prior year, going from 2.11 million to 2.18 million. And that amounted to a little over 63,000, which was a 3% increase. On the other hand, a hypertensive medication saw the most percentage-wise increase from the prior year in 2022. And that went from $4 to about $158, a 35-fold increase. That's crazy, you guys. So needless to say, the markup in the United States is really astronomical in some cases. I think we can fairly say that. But why is that? Let's think about it. Why are our prices so much higher in the United States? But besides that, let's talk about some practical reasons. So did you know that other countries actually put a cap on how much they're willing to pay for certain medications? And what they do is a cost benefit analysis, right? So they analyze this new drug that's being introduced. Is the cost of this new drug really enough to justify paying the higher prices based on its benefits? So if the drug doesn't show a significant increase in how much it will benefit the population or an individual, then that country may decide then it's not worth it to pay this increased amount in for that particular new drug. Whereas in the United States, it's a free for all. So perhaps one of the things we need to do is really look into this cost benefit analysis. I know we're founded on capitalism and the importance of capitalism, but these are human lives we're talking about. What's the cost of that? I know Big Pharma will say, the United States, you get drugs faster than any other country and you have less restrictions. So what's the big deal? The big deal is we don't want to just have drugs available that people aren't really taking, according to the CDC report. That's the big deal. Another aspect is patent restrictions, whereas in other countries, they're a little bit more stricter when it comes to patents. So yes, when there's a new drug on the market, there is a certain protective period in which that medication won't have any competition because of the patent restriction that restricts the formation or the production of generic medications. Well, it's said that in the United States, companies are able to extend those restricted time periods a little bit longer than they would in other countries. And you guys, we're not saying that in other countries they're getting different medications. They're getting the same medication produced by the same companies at lower prices. That's what we're talking about. Apparently, the word on the street is that Humira was able to extend its patent restrictive time period to up to 4 years. And that restricted the ability of other companies to compete by producing generic forms of the medication. Now, have you heard about pharmacy benefit managers? Actually, most Americans don't even know these companies exist, but you should because they are very much representing you, whether you know about them or not. So, pharmacy benefit managers, which don't exist in other countries, are yet another reason why our drug prices are higher. So, pharmacy benefit managers are kind of these in between negotiators that nobody hired, but we're all dependent on them. And essentially, what they do is negotiate with the drug manufacturers for the pricing, that employers and healthcare plans will pay. So, are you doing the math? If healthcare plans are paying higher prices, then we're paying higher premiums, co-pays. You get the math. The math is mathing, right? But we don't like the result of it. Essentially, the criticism is that perhaps their incentivized structure don't really have our best interest in mind, that they get a little bit more fees paid out from the drug manufacturers when there is a higher sticker price. And who ends up paying that high sticker price? You got it. I know some people will say in certain instances, doctors also benefit from this, but I will tell you that most doctors are hired by structures, by institutions, by hospitals, by group practices. So when we talk about doctors getting a kickback, we're talking about the small portion of doctors that have their independent practices and are able to manage their finances more. Here's the concern. The concern is that some medications that are used to treat patients, especially cancer patients are usually talked about in this scenario, that the doctor will then pay for the medications in advance and then bill Medicare for the cost of the high priced medication and then some. Guys know I'm going to be straight with y'all. That's where the criticism comes in, that some doctors are getting kickbacks from and are incentivized to use higher priced medications. And so ultimately, patients end up paying higher prices or higher costs due to this odd incentivized structure. So let's talk IRA. And again, as a reminder, IRA, we're talking about Inflation Reduction Act. Did you know this act, even though many Americans are finding out about the act as a result of the State of the Union, was actually signed in August of 2022 by the current president. Now that you know that one part of the IRA has led to a reduction in the cost of insulin and a cap of the amount of money that needs to be paid for that medication on a monthly basis. Did you know that there are other medications that were on that list? In fact, there are 10 other medications in the first rollout of negotiations between Medicare and drug manufacturers. So let's talk about the conditions in which those medications treat. Did you know that there are multiple diabetes medications on that list? In fact, there was also medications that treat blood cancers, rheumatoid arthritis, Crohn's disease, psoriasis, as well as heart failure and blood clots. That's a pretty impressive list. But certainly many of us can think of other medications we probably want on that list also. So let's now talk about other impact the IRA will also have on Americans. One of the concerns for a lot of Americans is the fact that, yes, inflation happens, but a lot of us have watched prices that have soared beyond what inflation can even explain for. We'll talk about the food industry in a minute. But one of the things that is great about the IRA Act is the fact that it requires these drug manufacturers to pay a rebate to Medicare when their prices are above the pricing that should be predicted based on inflation. Now we're talking about it, okay? There's also a plan to cap the out-of-pocket spending of those who are enrolled in Medicare Part D. And there's a plan to eliminate cost sharing for adult vaccines for those enrolled in Medicare and to increase access to those who are enrolled in Medicaid and CHIP. And these are just a few examples in which the new IRA will positively impact not just the pockets, but also the health of Americans. In fact, it's estimated that it will help 2.1 million Asians, 5.8 million Blacks, and 5.3 million Latinos. Now let's talk about another favorite topic. Let's talk about this new Women's Health Research Initiative. Woohoo! This is an initiative that will be led by the First Lady, Joe Biden, and also the White House Gender Policy Council. This initiative, even though a lot of Americans are just finding out about it, it was actually announced since November 2023. That's right, 2023. And we are so excited about all the potential it has to do, right? But we want to make sure that we are on that agenda. Let's talk about what I'm referring to. This fund will receive over $100 million in funding. And it's important because did you know that only 30% of the world's researchers are women? Did you know that 12% of national science academic positions are held by women? 12%, you guys. 12%. That's outrageous. But I know it because I live it. In an assessment of over 1,400 clinical trials, only 41.2% were women. Guess how much we are in the population in the United States? A measly 50.4%. Okay. So clearly underrepresented academically as researchers and underrepresented when it comes to enrollment in clinical trials. And that's a big deal because a lot of our medications, treatment plans, how we sponsor certain community programs and things like that are based on these trials, how people get vaccines. We saw this from the pandemic. Do I really need to go into the details? We lived it. Let's look at these numbers even in more detail when it comes to certain common disease processes. When it comes to cardiovascular research, 49% of those affected by cardiovascular disease are women, yet only 41.9% are in clinical trials. 51% of cancers in the world affect women, yet women are only 41% representation in clinical trials. 60% of psychiatric patients are patients who are affected by psychiatric illnesses are actually women, yet only 42% of females are included in clinical trials on psychiatric conditions. Help me understand this. In fact, the NIH itself has reported that conditions that affect women predominantly are underfunded in comparison to conditions that affect men predominantly. So not only underrepresentation in terms of researchers, representations in clinical trials, but also just what conditions are being researched is a huge disparity. This is why this initiative is so important, you guys, and why my ears peaked up to hear that it was announced and that there is national attention now being paid towards helping women. You know, there are certain conditions that have been known and have been around for a very long time and have a significant impact on the quality of life of women that just have not been researched in order for us to understand them well enough to treat them appropriately. And this is not just a US problem. We're looking at the entire world when it comes to this issue. And here's the thing, if we're so focused on capitalism, it still doesn't make sense because it's been shown that investing in research that help women has one of the highest return on investments. So capitalism doesn't explain why there's a disparity. I'll give you a few examples if you're not convinced. One example, if you double the current budget of the NIH when it comes to studying coronary artery disease, which is currently 20 million, if you just double that in terms of the focus on women, the return on investment is estimated to be more than 9,500% return. Find me a company that gives you that. Similarly, if you double the investment when it comes to studying women with rheumatoid arthritis, your return is going to be 174,000%. You heard me, 174,000%. Again, Find me a stock that even comes close to that. So not only is there a disparity, but it doesn't even financially make sense that we're not focusing on research that will improve the lives of women, because the return on it is beyond anything that you're going to hear from any company. So capitalism is not the excuse. This initiative is important because it has the ability to work with not just different sectors of the current government, whether you're talking about the U.S. Department of Health and Human Services, or you're talking about the defense or the Veterans Affairs, but it also has the ability to engage the private sector, to engage community organizations, because a lot of us are interested in helping this go forth and seeing the results of it. They also have the ability to be a very well visible mouthpiece to make sure that we are paying attention to conditions that adversely affect women predominantly. So certain conditions that we are lacking and where there's huge gaps in research include rheumatoid arthritis, menopause, Alzheimer's disease when it comes to women, cardiovascular disease, which is still the number one killer in the United States and in many countries around the world. Yet we have insufficient data when it comes to cardiovascular disease in women. We know that women don't present the same when it comes to heart attack. Our EKG is as effective in detecting the conditions of women. So let's talk about it, you guys. Endometriosis, fibroids, this is where we get very specific, because we want to see not just that there's an overall initiative to look at conditions that affect women, but we also want very common conditions that affect subgroups of women to also be important. Because as we know, Black women, Latina women, Asian women are underrepresented when it comes to these research. Yet we are different when it comes to disease and disease processes and how it presents and how treatments affect us. There's no reason that fibroids should not be on this list. Okay, we know that our current vice president has been a huge defender and advocate when it comes to fibroid research. If she's a huge advocate and this is going on in the same administration, we better see fibroids on that list. Okay. There's no reason fibroids, with how much it impacts the quality of life, the decrease in productivity of women, should not be on that list. So, what we are asking for, and we need to have an ask. We can't just hear about this initiative and as women of color not have an ask. And our ask is we want endometriosis, we want infertility and how it affects women of color, and we also want fibroids on that list. I don't know. What do you think? That's my list. That's what I'm asking for. And that's what I want you guys to help me ask for as well. We also want to make sure autoimmune conditions are on that list, right? Lupus needs to be on that list. Need we say more? Why isn't lupus on the list? Lupus needs to be on the list. Hashimoto's disease. And I'm not saying that just because I have Hashimoto's, because autoimmune conditions disproportionately affect women. Women carry those kids, and those babies affect the immune system of women. And oftentimes in the postpartum period is when we start to detect these autoimmune conditions. So if autoimmune conditions are more predominantly affecting women, and it has some relationship to the hormones that are needed to carry these babies, then we need to see autoimmune conditions, especially the most common ones, on that list. Put it on the list. So what else do you guys want on that list? Let us know. Make your comments. We want to know what conditions you feel should be on that list of conditions that adversely and disproportionately affect women. There were two other things that were mentioned that I'm not going to go into today because we're going to touch on, and we either touched on it a little bit before or going to touch on it a little bit in the future. Hint. We're going to talk about that food industry and those food prices and the fact that they are significantly affecting already food deserts throughout the United States that are predominantly in minoritized groups, communities. We're going to talk about that too. And we also heard the comments about detecting fentanyl better so that we can minimize the smuggling of fentanyl into the country. But we also want to make sure that all the groups that are responsible for that are targeted. Intent. Okay. And keep in mind that one of the reasons why that's important is because we know that mental health conditions as a group, which includes substance abuse, is the top killer when it comes to pregnancy in the United States. Is the top with the latest data that's out. So It is a very important condition when it comes to pregnancy and pregnancy-related complications. So that is a priority as well. But we're not going to get into the details of that. But I just want to make sure that you guys are paying attention to all these health topics that came up in the State of the Union, because this was the state of healthcare. And I am Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube, and the hand behind the handle of Healthy Bump Club on Instagram. We thank you guys for watching. We hope you paid attention to all these things that were talked about in the State of the Union. And I'm happy to have been here to present with you the state of healthcare. Thank you once again for supporting us. Make sure you check out all our other videos. You don't want to miss any of our topics. And as always, thank you for supporting us. Make sure you comment, like, share, and subscribe to our channel. And we hope to see you guys when? The next episode.